more than I want any of my patients to. So what you're going to discover today, the symptoms, the outcomes, how we're going to prevent it, what I'm doing at my office to prevent things with my patients that are coming into the door, to protect the healthy patients, to treat the sick patients, and to make sure my own dogs at home are safe and the like. And a special emphasis today on little dogs, because little dogs are not just small, big dogs. When it comes to this upper respiratory infection, they're a special case and they need special prevention and acute aggressive treatment. So, what's the infection look like? Is it contagious? The dogs, yes, yes, yes. Is it contagious? The people, no, no, no. Cats, not so much. How is it treated? How can you protect your dog? We're going to look at all of these today and more. So this is a highly contagious, multifactorial disease. What does that mean? Well, it boils down to the fact that my profession has identified over 30 organisms, viruses, bacteria, mycoplasma, to name a few, subcategories. Not only do over 30 organisms are capable of creating this disease, it's rare that any one dog has only one. They have 2 or 3 or more, and that's when it gets dangerous and bad and potentially life-threatening. It spreads rapidly to susceptible dogs, and only a handful of those 30 infections can be prevented by vaccination, but they're also the most common. So vaccination is part of our critical preventative care to make sure that your dog doesn't get sick. The dogs at highest risk are in boarding kennels, doggy daycare, rescue centers, even outdoors, dog parks, dog competitions, dog venues where you have dogs meeting together for whatever reason. Even grooming parlors are at higher risk. Dogs meeting on the street are not immune. So, what are the symptoms? You get this loud, and I mean loud. You got a dog goes, But if you got a dog goes, and again, and they're coughing and retching, and your first thought is, my gosh, Fido's got something stuck in his throat, then you're on to something, because that could be the first symptoms of kennel cough. Most of the time, these coughs come right out of the blue. You have no warning. Fido's pretty healthy to start out with. They've been eating, they've been drinking, they've been playing, they've been doing this, and all of a sudden you get this, a very large percentage, if you start tracking their dog backwards, have been around other dogs 3 to 5 days before. Boarding kennel, dog park, whatsoever. Of all the patients that I've seen forever, I would say less than 5% have pretty much no direct canine exposure. Yes, you can get it from grass. Yes, you can get it from sniffing hair, particularly if your dog's a hoover and rolling through the grass and rolling through where some other dog might have been coughing or salivating or licking. High risk of the potential for those. But you're going to get this cough. You're going to get this retching type sensation. Many times they'll bring up a white foamy type material. Fever in the initial stages, very, very unlikely. Possible appetite loss, but again, not that big of a deal. Nothing that gives a big red flag, but you get this loud cough that you think is very possibly associated with something stuck in Fido's throat. No matter what, when you got that type of severe coughing, gagging, retching, whooping cough type sound, time to get Fido checked. Time to get Fido checked now. So, if the symptoms progress, you get appetite loss, you can get fever, you can get nasal or ocular discharge from their eyes to the nose, and Fido starts feeling bad. They start feeling puny, and they're not doing that well. If they start having real breathing problems, and have abdominal respirations where instead of you look at Fido from across the room and you're not sure his respirations are kind of a non-event and you normally aren't paying attention, and all of a sudden you're getting these heavy breaths, and the breathing's coming maybe from the abdomen, could be a problem. Could be a possibility. I'm going to sneeze here in a second. We'll see. But if they're having labored breathing or any breathing problems at all, you need veterinary intervention now. So, mitigating factors. If Fido's in poor health, not a good risk factor. If they've been under a lot of stress, there's a lot of emotional upset around the house, if their vaccinations have been lapsed, temperature changes can give you a significant problem. We see many times humidity that goes up, and double whammy for boarding kennels and daycare that are indoors because they're using a lot of water for sanitation purposes, and probably rightly so, but that increases the humidity, increases the water vapor particle droplets in the air, and guess what? These are the transmitters for this upper respiratory infection. Little dogs are a big problem, and we'll see that in a second to why. But what's really happening is that in this severe killer cough, mysterious type infections that we're seeing, the symptoms start out the same as classic kennel cough, but we start getting different outcomes. We start getting different outcomes. Instead of a disease that lasts maybe 3 to 5, maybe 2 to 3 weeks tops, where Fido's not that sick and they have some cough and they get some medicine and you make sure they don't get pneumonia and they ride out the storm and you're just fine. We're seeing 3 different clinical outcomes with these kids. Mild, where they have this upper airway infection. They're not too terribly sick. They can be treated as an outpatient, but they're sick for an extended period of time, and they're coughing for an extended period of time. 6, 8 weeks, that's 2 months or more, sometimes 3 months. Not good. Second is a much more severe situation where the patients need to be hospitalized, they're developing severe pneumonia, and they're not responding to classic protocols, at least they weren't initially. And the third outcome, which no one of us even want to talk about, are outcomes where in as little as 24, 36, 48 hours, you have a very poor outcome, which translates into Fido croaks. We know nationwide that emergency centers, referral centers, and insurance companies are reporting approximately a 50% increase in caseload for pneumonia diagnoses over the same period last year. So that doesn't mean 50% of the dogs who are walking around the street are getting sick, folks. But that does mean that the sickest of the sick are basically doubled on what's going into the urgent care centers. We know a lot about what it's not at this point. We know it's not any classic upper respiratory infection things of that list of 30 that we're talking about, because most of those can be tested for. And the majority of these dogs aren't showing any, if they do show 1 or 2 of those positives, it's a rainbow spectrum across the board. There's no one finite winner, so to speak, of who's on first and what's causing the disease. There's a list of the things that we test for commonly. You don't have to memorize that, but you will be tested at the end of the lecture. That was a joke. So what we're doing in our office, we're screening for all upper respiratory infections, telephone, conversation. If you got any nasal discharge coughing thing, we're going to triage you in the parking lot. I'm going to be out there in the rain with an umbrella if I need to make sure that your kid doesn't have any problems whatsoever. So, we're screening for upper respiratory infections, as I said, curbside triage, and we're using upgraded treatment plans based upon current knowledge of what's being successful and the like. Personally, I'm canceling dog shows. I'm not. We stopped going to the largest dog show that we normally go to, especially at here in Palm Springs, and it's just a time to stay home and apply social distancing. When I say social distancing, I'm talking about no nose-to-nose contact. This is definitely out. No, no going down the street, strange dogs going around. I'm going to kissy poo you guy and have fun, and no circling and smelling butts or anything like that. No known, no social distance, no direct contact. Got a social distance. So what you can do is pay attention to all aspects of Pupster's health: diet, exercise, nutrition, vaccinations. Make sure everything's on top schedule, and social distancing. Social distancing. So, what about these little dogs? What about these little dogs? Little dogs have little windpipes. Not rocket science, you're going to say, Dr. Bruce. Well, the reality is, go back to when we were all in high school. We sat around the soda fountain, and we got out a straw, and we started breathing through it. If the straw was small, this is a big straw, but that's not too bad, we could take a couple breaths, no problem. The straw should be this, think about the last time you went snorkeling or scuba diving or something like that. How big is that snorkel? That snorkel is huge. It's actually bigger than this. This is an endotracheal tube for a Bernese Mountain Dog. It's about the size that you could use, maybe even bigger for myself. Endotracheal tubes are tubes that are used for general anesthesia. These are people tubes we use for dogs all the time. If I were anesthetized and this were my windpipe, I would be breathing like this. Pretty normal, which is good, because if I'm anesthetized for 2 hours with some kind of major surgery, it's good that I can breathe pretty normal. If the windpipe, it's in my, if I go to the soda fountain and I pull out that straw and I get a little straw, watch what happens with my respirations when it's not big enough to satisfy my airway, my oxygen demands. What's happening? I'm having to take really deep, heavy breaths. I'm having to accelerate and speed my inspirations as much as I can so I can get more airway. And with that size, when I need this size in a few minutes or less, I'm either going to give up and go back to slurping my soda, or if this is the only way I can breathe, I'm going to pass out. Not a good choice. So, once upon a time, there was a guy by the name of Bernoulli. And Bernoulli said, he made this little tube. It's a tube similar to this, but it's pinched in the center. It's restricted in the center, right? You can see it on the, right side of the screen. And when he sent air going through that tube, he discovered that the pressure at the narrowed spot where I've got my finger hair pitched, the pressure as the velocity goes through drops. And the faster the velocity, the bigger the drop. The faster the velocity, the bigger the drop. So what does that mean? Think about that in the center of an airway. The center of the airway in your dog isn't perfectly rigid like this tube. And a Bernese Mountain Dog and a huge breed dog, and in you and I, it's pretty solid and it's not going to move. What happens if you got a 5-pound Chihuahua and a windpipe that's that big, and it's not as strong, and it doesn't have as much cartilage in it, and the cartilage is weak in the first place, and air starts going through here, and the dog coughs through it with a high velocity? All of a sudden, there's a drop in pressure, and what happens with a drop in pressure? The lumen, the diameter, the center of that starts wiggling and gets weak. And that weakness is a condition in dogs that we call collapsing trachea. And in collapsing trachea, guess what happens? It can collapse. Here's a radiograph of a dog with a collapsing trachea. This is about a 10-pound Pomeranian. You can see the arrows, the center, that black squiggly line down the center, trying to get a pointer working, and I don't think I can get my pointer working, so you're going to have to use your imagination and focus on these four sets of arrows, but in the center, you can plainly see that that's really narrow. What happens when the velocity goes through here even more? It gets pinched even more and more. And guess what? Cough gets more cough and more cough and more cough and more cough. If this patient's coughing isn't stopped quickly, it's going to get worse and worse and worse and worse. And guess what happens when it gets worse and worse and worse? This breed, these toy breeds that we get for a lot of different reasons. We love them. We cherish them. We can walk around like with them under our arm and all that. They're supposed to live to 18 plus or minus, right? With that collapsing windpipe, they're not going to make 18. They're just not going to make 18. And that's really sad. So those patients have to be treated aggressively with cough suppressants, and whatever is causing that cough, like pneumonia, has got to be assuaged. It's just got to be assuaged. So, what can you do? Well, one thing that you can do is download my Killer Kennel Cough cheat sheet. In the link below, you'll find a link to get my Killer Cough one-page cheat sheet. It'll tell you everything you need to know real fast about how to keep your kid on the track. So today we've talked about all aspects of kennel cough, from how to prevent things with social distancing, vaccinations, and the like. We've talked about symptoms. We talked about recovery. And if you have any questions, I'll be able to entertain them at the end. But before we go to questions, I want to thank you for joining me here today, investing your time in your dog's health. Your pupster will not be sorry that you did. Again, thanks for joining me here today. It's me, Dr. B, saying thanks.